Sometimes as researchers, clinicians, and students, we become very narrowly focused on our specific areas of study and forget how it fits into the world around us. Our next speaker is going to challenge us to start thinking a little bit more globally. Please help me welcome to the BRUTx stage, Dr. Wondwossen Gebreyes.
25 years ago, I was lucky to receive my Doctor of Veterinary Medicine degree from the only veterinary school in Ethiopia, the Addis Ababa University. I was excited, young, and ready to make a difference in the world. Once I was assigned in the south part of Ethiopia, I faced the reality. The infrastructure was very low, whereas the needs were huge. Trypanosomiasis was ravaging the cattle, diarrheal diseases in children, food safety, and so many responsibilities that I was assigned to solve. However, I noticed this discrepancy in the world that it was not an easy task to achieve. That brings me to the story that I will share with you today. One Health, One World, or Global One Health, that we are doing at Ohio State University. I would like to ask you, how many of you heard of One Health? Okay, great. So many people heard of it. How many of you are engaged in some capacity, locally, regionally, or globally? Few hands. Okay, hopefully we'll see more hands in the future. How many of you, I'm just curious, are part of our consortium here? I think we've got a few members, so thank you for everyone for contributing to this initiative. One Health, that as endorsed by the American Medical Association, American Veterinary Medical Association, American Public Health Association, as well as a number of other national and international organizations as defined as it's shown here. Particularly, the main part is the interface. Remember the three-legged stool. What makes it strong is what's connecting the three legs, the interface. So my focus would be at the interface. In the world today, we're facing a number of factors that affect human health. Climate change, urbanization. With the population increasing from the currently 6 billion to 9.3 billion by 2050, you can imagine the number of resources that are changing, shifting, deforestation, changes in vector-borne diseases, and others. Remember, the planet size remains the same. Our population is growing. So we need to have an efficient way and systems that we work together. The World Health Organization estimates that currently the emerging infectious diseases in humans are of animal origin or ecosystem origin, or even chronic diseases in terms of interface between human health and the environment, pesticides, a number of other risk factors. One Health works in this left-hand side of the slide I'm showing you. How do we prevent infectious diseases emerging in humans before they occur in humans? Because often they amplify in animals way before it occurs or causes a catastrophic epidemic in humans. Change in climate affecting the vectors and then amplifying. So it works on this left-hand side of the corner before it causes major outbreak. Ebola is a good example that we're facing currently. MERS, or Middle East Respiratory Syndrome, SARS. You hear so many stories in the world today. One more slide I want to show you, that's why we need to embrace One Health, is this. Often people think that I'm not traveling to West Africa or Middle East or Asia. I am safe, protected, sitting in the United States. But this is from Institute of Medicine, the well-traveled salad example. On average, a salad that we're consuming at any given US restaurant the ingredients can possibly originate from 33 different countries all over the world. On average, it might be 10 to 15, but possibly because of globalization, food trade. So it's everyone's responsibility to stay safe. It is our own collective responsibilities to work in globally. So let me share with you one model, One Health partnership that we all at Ohio State are doing. In 2012, the 7 health science deans their global program leaders, including myself, with the leadership of the Office of International Affairs, developed a strategic plan with the Ethiopian partner universities particularly, as well as the Ethiopian government, to engage in building capacity, both for Ohio State community as well as our Ethiopian partners. There are so many reasons why Ethiopia. Of course, this can be done in any part of the world. Ethiopia has the second largest population of 91 million or more. No history of European colonization. Therefore, there is no strong partnership, either a Franco, Cote d'Ivoire with France, or Kenya and Tanzania with British, and so on. So there is opportunity to partner. Ethiopia currently has one of the fastest growing economies. In fact, a few days ago, CNBC said it is the fastest, but I'm not sure. Don't quote me. Also, together with this economic development comes the commitment of the Ethiopian government to expand higher education. The veterinary school, I told you long ago, that's the only one in the country. Right now, there are 11 veterinary colleges. From 3 universities 10 years ago, right now, Ethiopia has 34 universities. That's an opportunity for partnership, make a difference, and make a win-win partnership. Ethiopia is also the home of the African Union. It's the capital of Africa, you can call it in one way. So by working in Ethiopia, you can also reach out to any given country in Africa. Various different reasons. Who are working in this partnership at Ohio State University? We are really happy, and I'm pleased to tell you that right now 13 academic units are involved in this partnership, besides the health sciences, education, human ecology, business, engineering, social work, and so on and so forth. And 3 non-academic units: Office of International Affairs, Office of Outreach and Engagement, as well as Office of the Chief Information Officer, OCIOR partners. So I'll walk you through some of the activities. But before I do that, what is our overarching goals? It's very simple. Our goal is to develop capable professionals, both for Ohio State, as well as our partner, in this case in Ethiopia, who can address complex global health issues at this interface of human health, animal health, and the environment. Okay. And also at the same time, while we build capacity, we make impact on the global public in terms of improving health and lives of many on both sides. And working globally helps our own Ohio State community as well as a land-grant university. We use various mechanisms, but we often cross-fertilize knowledge. Our students learn a lot in developing regions, whereas the developing region partners also learn a lot. Here are some examples from our College of Nursing and Social Works at the University of Gondar doing a study abroad program. Or Dr. Janet O'Quinn with a student, Maria Bello, and University of Gondar student doing a spay-neuter, teaching a spay-neuter of dogs to prevent and control rabies. So capacity building is the key focus. But the mechanisms are this. We use 3 different ways. One is every year we do One Health Annual Summer Institute. We've been doing this since 2012. Number of you, as well as various colleagues, have been involved. Here is an example. Dr. Armando Hoet from the College of Veterinary Medicine and College of Public Health is teaching international trade and public health for early career faculty members, training the trainers that originate, even though it's hosted at one university, the trainees come, in fact, from various universities in the country. So training is one module. Second is service learning. The service learning mainly benefits our students, Ohio State students. Here is an example from Fisher College of Business. 6 of the MBA students traveled to Ethiopia last year, again as part of, in fact, the rabies prevention and control project. So Fisher College of Business doing rabies work. Why? We needed supply chain knowledge, logistics, marketing. None of us within the 7 health science disciplines had that knowledge. So One Health is not about just health sciences. This really includes a number of other expertise, including business. The third is research, innovation. In fact, I'll share with you a little bit more detail, but here is an example of 3 students from public health and veterinary medicine working in a pastoral area afar on the Middle Eastern respiratory syndrome in a pilot project. So these are the 3: training, service learning, and research are the main anchors. So let me get into more specifics. Okay, innovation. We are here, in fact, as the CCTS conference. Innovation is one of the key aspects. We have a project on tuberculosis, mainly animal-borne tuberculosis. As you all know, tuberculosis is one of the major killers globally, particularly in the developing region. What you see here is a farmer in Ethiopia. He is not kissing the bull, okay? But what he's doing is he chews tobacco as he does his plowing, farming, and then the bull gets tired. He feeds his leftover tobacco in his mouth, mouth to mouth, to the bull, to the red bull, to get him energized, okay? So then continues plowing. But what's happening at the same time is passing these infectious agents, typically tuberculosis. The farmer can pass Mycobacterium tuberculosis to the bull, or the bull can pass either Mycobacterium tuberculosis or Mycobacterium bovis back to the humans, and then gets into the community through unpasteurized milk consumption in so many different ways. Through a funding provided by CCTS L pilot project, led by the College of Medicine colleagues, Dr. Sue Wang and Dr. Jordi Torales and myself, we have developed a prototype test, rapid, cost-effective, field deployable, or it's not really bedside, but point of care diagnostic method. Okay, and then we are currently really implementing it in Ethiopia, from innovation to implementation. This is a very useful thing because currently TB detection method, if it exists in this part of Ethiopia, for example, it takes 4 to 8 weeks. Whereas this a quick strip system takes only 20 minutes. It's very rapid, at least as an initial screening. Secondly, we can also differentiate a susceptible tuberculosis strain from multi-drug resistant TB strain 1. So it's very useful. So this is one good example. Another one, more of an implementation, not so innovative, is on rabies prevention and control. Rabies is classical old zoonotic disease, but remains invariably fatal, 100% case fatality. There are effective vaccines exist in the world. The risk factors are known. Dogs are very important risk factors, more than 90%. In fact, yesterday on WHO website, I read it's 99%. The risk factor is exposure to dogs and dog bites. By the way, yesterday was the annual rabies day. Okay. In developing region, despite the fact that there are vaccines and effective known risk factors, still many people die, particularly children under the age of 15 years old. In Ethiopia, 44% of the population is under 15 years or younger, and there is no effective education system. You see lots of stray dogs. This is close, especially close to restaurants. You know why they are there. Okay. So what we are doing is together, is in partnership with our Office of Outreach and Engagement, we won a competitive impact grant award 2 years ago, and we have been working with 16 Ethiopian institutes, the Ethiopian government, regulatory, research, and the implementers, and yet the US Center for Disease Control and Prevention. In fact, as I speak here today, the CDC, Ohio State, Ethiopian government are conducting an implementation workshop, and that's why Dr. Tim Landers is there representing our consortium as well. So our partnership, one thing I really want to emphasize is it's a mutually beneficial partnership. We focus on a win-win partnership model. This is an example from College of Pharmacy, okay, on pharmacognosy, on Dr. Leva's lab. Person you see on the left is Mr. Ermias Addo from Addis Ababa University, learning pharmacognosy techniques in our College of Pharmacy. What is the College of Pharmacy and the global public benefit is a candidate medicinal plant. In fact, they just published a study on a potential cancer therapy ingredient that's from specific endemic plant, Ethiopian plant. So we in all our aspects, as much as possible, we have a win-win partnership so that we can sustain this partnership. It's not a one-way process. Our College of Nursing is leading a cervical cancer project because in Ethiopia, for 91 million people, there are 4 oncologists, okay? And there is only 1 linear accelerator for the whole nation of 91 plus million people. If I ask you maybe just to give you a comparative perspective, how many oncologists are there in the OSU medicals within the James Comprehensive Cancer Center? How many of you say 50? How many of you say 200? Okay, quite a few hands. How many of you say 500? Okay, so the 500 is quite wrong, but the 200 is yes, 200 plus, just in one medical center. Just imagine Columbus for maybe a couple of million of us, how many hospitals exist, how many oncologists. But 4 oncologists for 91 million people. So our James Cancer Center, as well as College of Nursing, in terms of the screen and treat, focus on cervical cancer, are working on this area. And technology is, it's been wonderfully overwhelming the last 3 years for me. I am blessed to be part of this team to make this difference. But we have a number of interesting partners. And we want to make our, maximize our impact, sustain our partnership. For that, we felt that technology is very important. So last year, we received our first digital first impact grant from the Office of the Chief Information Officer. And we have been working with the Distance Education and E-Learning Unit, developing 5 iTunes-based courses: molecular epidemiology, environmental health, food safety, geospatial analysis, evidence-based medicine. By the way, these courses not only benefit Ethiopia, but it benefits our students as well as the global public. Okay. Through that grant, we purchased 40 iPads, 20 of them distributed to our students at Ohio State and 20 with our East African partners, so they can cross-communicate. In fact, that led to an NIH grant. So we recently, just a few months ago, we received an electronic capacity building grant from NIH. So we're really strengthening on this area. In terms of impact, really for a 3-year young partnership, we feel very much blessed and happy that our momentum is wonderful. We're making various impacts, both in our students, our partners in Ethiopia and other parts, as well as the community. However, there are always challenges. So I need to show you some challenges. For there is no, and not everything cannot be perfect. Okay. Even though we are attracted by various disciplines, remember that we are all compartmentalized into departments, colleges, and others. So there is always the silo effect. It may not be in your department's patterns and administration to participate, or it may not be necessarily encouraged. Global health general may not be encouraged in your department. There are always there are some variations. It's great to see discovery teams that really links us across in the 3 major thematic areas. So that's needs to be encouraged more and more as we get into one university. The second is impact versus revenue. We're making lots of impact. We are very happy, extremely happy about the impact we're making. However, there is always, again, to run a university, we all understand that there is indirect cost. Your department chair may like to have, is this a full indirect cost? The 54.5 effect, that's what I call it. The NIH level of indirect cost. But often global work may not result to that kind of indirect cost. But we hope you still be encouraged to working with us. Beyond Ethiopia, I have to tell you that we established an international Congress on Pathogens as a Human-Animal Interface, ICOFA. And we have been running that since 2011 between Ohio State, our East African partners. What you see in blue is really our strategic areas. With Brazil, in fact, we just received a State Department grant to work on in Brazil on One Health, on antimicrobial resistance is the focus, and Thailand and others. Right now, ICOFA, in the last 5 years, we have so many regional partners. In fact, we have about 993 in the network. If you are interested to know or get engaged in other countries, also let us know. It's not only Ethiopia. We have a number of networks, and this is led by Ohio State University. So finally, I hope I convinced you that this is a great partnership that helps us all in the world. We are dealing with complex problems that necessitates an interdependent, collaborative working relationship. So I call upon you to join hands and make a difference for the future of our children. Thank you very much.